Good afternoon and welcome everybody. I hope you're enjoying the good weather. I hope you're out walking and going on the beach and doing all the things that are healthy for you and also keep that horrible COVID virus away from you. So I hope all of those things are being done. But we're looking forward, because that's the way we must do it, in relation to our general policy, which is now that we realise we cannot and will not eliminate the COVID virus. So we're learning to work with it and live with it. And we believe that we're on track to do that, because not only have we got one of the best vaccination programs in the world, we've also got a sensible and balanced community that are overwhelmingly generally realising that we've got to live together and taking appropriate action. Well, on Monday the 16th, just a few days away, we will see a significant reduction in travel restrictions for those travelling outside of the common travel area. That will be for people who are vaccinated here, the UK, the EU, plus what's called EFTA countries, that's Norway, Iceland, Liechtenstein and Switzerland, and also the British Overseas Territories. If they are coming in from the common travel area, they'll be able to use the blue channel with no need to isolate, but of course they'll have to carry out the self-administered lateral flow tests. If they're coming in from anywhere else in the world, except countries on the UK red list, then they'll be treated as Category 2 arrivals. That means they can be released from self-isolation after a negative result of their day arrival test, and they'll need to take a second PCR test on day 7. Now, we know that's going to open up opportunities for people to see friends and family they haven't seen for a long time, and we very much welcome that. And we are aware, everybody's aware of how difficult the period of separation has been for so many for the last 18 months or so. Now, of course, whilst I'm pleased, and all my colleagues are pleased, to recognise the vaccine certificates from those additional places, i.e. the EU, EFTA and the British Overseas Territories, sadly, we do not yet have a way of recognising proof of vaccine from other jurisdictions. Those wanting to travel to the bailiwick that have been vaccinated outside of those areas that we've talked about will need to adhere to our category rules, and that will be dependent on their travel history. This is a staged process. We are devoting resources to it, and as soon as other countries, we are satisfied with the vaccination certificates from other countries, they will join the list of countries that we've already referred to. But there's still some way off. There's still some work to do in relation to that. So we're saying to people who have friends, who have family in those countries, please hang on, because we are trying to move forward. Now, of course, the use of the lateral flow test has been in operation now for about a week, and it's working because we've had positive tests identified both in relation to visitors and locals. So we thank people for administering them in the way that they've been doing, because it does depend on trust. But again, we need that trust to be fully accepted and implemented, because it means that we can live with the vaccine going forward. And then, although it isn't the policy to eliminate the vaccines, it is to try and minimise it, because we've got to protect both our community and our hospital. Now, it is a legal requirement to take the lateral flow test, and Dr. Brink will explain how that helps us identify cases shortly. Now, we know that there are some community cases, and that is alarming to some people. Of course, that's understandable, because we've had such success in managing the spread of the virus between the various lockdowns. With that in mind, I think it's worth taking the opportunity to again emphasise, as I've just done a few sentences ago, that we realise we're not going to be able to eliminate the virus. So the figures that we've seen have neither surprised us nor alarmed us. What we're trying to do, as I said before, is keep the number of cases as low and manageable as possible. What success looks like under the current strategy is different from what the position was under the previous strategy. We are not seeing the exponential rises that we saw in the first two waves, and we know that, thankfully, more people are not having to be seriously ill. More people are not being affected as badly as they were or would have been under the previous waves of this infection. We've got to protect our healthcare system. It is coping well. It will continue to cope well, but we have to have, as I've said, a positive personal responsibility. Now, the vaccination programme, which I've already said, 85%, if I've got the figures wrong, Dr. Brink will correct me, 85% of 18 pluses have had both vaccinations. Another 7% will have their vaccinations in the next 2 to 3 weeks, so we'll be well over 90%. For those people who want to change their mind, who have in the past said they're not going to have vaccination, there's no problem in that. They can change their mind, they can contact the relevant authorities, and they can have their vaccinations as soon as is practicable. Now, what our main aim is, our sole aim really, is protecting the health and well-being of all bailiwick residents. But probably the main event of the day, and that sounds a bit like a boxing commentator when he's about to say the main event of the evening, but the most important update today is in relation to our vaccine booster programme. Some of the details are still being worked out, but this week Health and Social Care and also the Civil Contingency Authority have agreed that those more at risk from COVID will receive the booster first. Dr. Brink will talk about what groups of people those are. Now, the booster programme, along with the vaccination for 16 and 17-year-olds, which began just this week, means that the current intention is that we'll continue to use Beausejour as the community vaccination centre, probably until the end of the year. It's been a wonderful facility. It's served us well. I'm grateful to everybody who's put so much effort into making sure that the service that's been given is first rate. And we're going to continue with that for just a bit longer. Anyway, enough of me. Over to you, Dr. Brink.
Thank you very much. So, just to start off with the booster vaccination programme, so JCVI have released some interim advice, and it is interim guidance and on who we should be vaccinating in the booster programme. So, of course, it is subject to change, but what we're looking at is implementing this interim advice. So they divide the booster programme into two stages, so stage 1 and stage 2. So stage 1 are your adults over 16 years living with an immunosuppressed individual. So adults over 16 years living with a, adults over 16 years and over who are immunosuppressed. So it's immunosuppressed adults over 16 years and over. Those living in care and residential homes, also really important. The other group is adults 70 years and older, your health and social care staff, and then adults aged 16 years and over who are considered clinically extremely vulnerable. So those are the categories for the stage 1 of the programme. Stage 2 will follow from the stage 1, and basically in stage 2 we're looking at all adults who are over 50 years of age. And then the second group we're looking at is those 16 to 49 years of age who are in an influenza or COVID at-risk group. So those at-risk groups are published by JCVI, and we stick strictly to the at-risk groups as defined by JCVI. And the other group that we look at is adult household contacts of immunosuppressed people. So those are stage 1 and stage 2 of the programme. As I said, it is interim advice, and we are, of course, looking at the emerging evidence as it becomes available to us. So the other important milestone in the vaccination programme is this week we started the vaccination of 16 and 17-year-olds. We had a walk-in clinic of 50, and we are delighted to say of 50 people allowed to receive a vaccination slot, and of those 32 were 16 and 17-year-olds. So in our very first walk-in clinic that was available to 16 and 17-year-olds, 32 young islanders took that offer up. Now, I think from our perspective, what is important is that we give out detailed information, the letter provided to 16 and 17-year-olds, but we're also very cognizant that people might have further questions, and they might be quite specific questions. So if anyone would like to ask us a question, so anyone 16 to 17-year-olds would like to ask us specific questions, or indeed their parents and carers, guardians and so on want to ask us specific questions, then if they email publichealth@gov.gg, we'll then look at trying to answer those specific questions. But that's really focusing on the 16 and 17-year-olds. So that's a huge step forward, and something that we really do welcome. But if we then look at the overall performance of the vaccination programme, again, it's going really well. So if you look at the over 18s, we're now looking at a total of 86% of over 18s who are double vaccinated. That really is an extremely successful programme, and we've got 95% of the 50 and overs being double vaccinated. Now, as we've always said, the aim of the vaccination programme is, of course, to protect against morbidity and mortality, so severe disease and death, and we're really seeing the impact of this as we move forward. So what I wanted to try and do on this slide is give you a summary of where we are today. So to date, we've had a total of 240 cases post wave 2. Now that was up to midnight last night. We've had a further 2 cases on our morning run this morning. So we've got 83 active cases and we've had 1 death in the second wave, and of course our thoughts go out to that family. At present we've got 1 case in hospital. So that gives you a snapshot as to what's happening bailiwick-wide. There's been a lot of interest in the number of cases in vaccinated versus unvaccinated or partially vaccinated people. So about 55% of our cases currently are occurring in unvaccinated or partially vaccinated people, 45% in fully vaccinated people. Now, the number of cases in fully vaccinated people is not a surprise. We always expected it. The aim of the program is to prevent severe disease and death. It will prevent some cases of infection, but not all cases of infection. But I also thought it would be useful to highlight where we are on our journey. So from March 2020, we've done over 137,000 COVID tests in the bailiwick, and we've had just over 1,000 positive results. So I think that gives you a snapshot of where we are and what our current situation is, and a bit about our history. But one of the things we've also been looking at is our journey, and what you can see here is the first wave, the second wave, and the situation that we're in now. So we don't have a wave of infection at the moment. We clearly had our first wave. Our first wave, of course, was in March 2020. Now that wave looks smaller than it actually really was, because if you recall at that stage, we had a limited diagnostic capacity. We could do up to 200 samples a day, which was incredibly good at those times, but all of us have massively ramped up our testing capacity. So that's probably about a 10-fold underestimate in the number of cases we had. This, of course, is our wave that we had in January 2021 when we went into lockdown in the 3rd week of January. And there we used a lot more testing. So we brought in surge testing at that stage, and we brought in testing of contacts of cases. And so you see a more accurate representation of the actual number of cases that we had. And this is our situation currently. So you can see there's a little hump in the trajectory, and that hump was the outbreak that you saw in Alderney, so the cases that we saw in Alderney. But what you're seeing is an entirely different situation. You're not seeing that exponential increase in the number of cases. Yes, we're seeing a rise in the number of cases. We always expected to see that. We knew that as we modified our policies with an increasingly vaccinated population, this is what we expected and what we prepared for. And as I say, this morning we've taken off 2 positive results. One is in a contact of a case and one is a community case. So we are seeing a small number of community cases on a daily basis, exactly in line of what we expected to see. But if we then look at the possible source of infection in a different way, and I've divided this very simplistically up into contact, travel and community. So you can see most of our cases, 41%, are detected out of the proportion. Proportionally, most of our cases are detected as contacts. So these are people that we know are contacts of cases, that we're monitoring and we're testing proactively. So those are all a managed situation, and that's important. Then we've got our travel-associated cases. So 38% of our cases are travel-associated. Now, what's interesting over the last week, we've seen at least 7, and I think probably an 8th from last night, travel-associated cases diagnosed through our lateral flow testing. And we're enormously grateful to both visitors and returning residents for participating in this program. These are people that came up on lateral flow positive and then phoned as discussed and as arranged to do a PCR test. And I think that is extremely helpful to us. Then what we can see is about 1 in 5 of our cases, 21%, are unknown community sources. Now that's exactly, again, what we expected, what we estimated, and what we planned for. So as we've moved from the 1st of July, it's evolving in a way that we expected and planned for, but obviously we can never be complacent, and we need to all be aware that we do have cases in the community and we need to take appropriate precautions. And I'll talk about that in a moment. Now the next graph is a little bit of a busy graph, but this is what we look at every morning in public health, and this is our case attribution. So with that, we're looking at the trajectory of active cases. So this shows a snapshot of active cases in the community now. And what you can see again is the highest number of cases is in your green group, and those are the contacts of cases. You can see the travel-associated cases going along in blue at a more or less stable rate now, and then the symptomatic cases are the orange group, and you can see that uptick in symptomatic people seeking healthcare. So we are seeing that increase in numbers of cases, but again, in a not in an exponential fashion. So I think that's important and shows you in a different way how we plan and how we monitor on a daily basis. So I think it then comes down to the fact of making sensible choices. Now, as we learn to live responsibly with COVID, we have to be very cognizant of the fact that we do have this virus in our community, and we have to consider how we make sensible choices, responsible choices, both for ourselves and others. Now, one of the messages that I know I hammer home, and forgive me for doing it again, is stay at home if you're unwell. When we speak to someone who's actually been symptomatic in the community for 2 or 3 days, it really is, we can't emphasize enough, if you are unwell, stay at home. You're not being a hero because you're feeling unwell going into work, because if you do turn up positive, we then have to contact trace around all of your work colleagues. And I think that's something that we all need to bear in mind. The other thing that you need to do is you need to consider your personal risk. So you need to consider what events you go to, what precautions you take at the events. We're not in a situation of legislating or mandating what islanders do. We're moving to a role where people take personal choice as to what they should be doing and what's right for them and the people surrounding them. What we'd also like to do with regard to face coverings is say to people, respect people using face coverings. If they want to use a face covering, that's really important, and particularly in enclosed spaces, a face covering can not only provide protection for yourself, but also for other people. Some businesses and so on may request you or ask you to use a face covering. And again, I think it's important that you respect those businesses' choices. So the other things that we need to look at, hand and respiratory hygiene, we've repeated that time and time again. But things like when you're out, not sharing cigarettes, not sharing vapes, things like that, again, those can be ways in which transmission can occur. So it's important that we consider this as possible modes of transmission. One of the pleas I have for contact tracers is also for businesses to consider and have their business continuity plans ready and available. So when we do contact tracing, some businesses will have all of their contacts, all of their shifts, can provide us with the details immediately, and it makes the process so efficient, enables us to contact trace really efficiently. Other people will struggle for 24 hours or more to get information. So it's really in everyone's best interest that people have that information available, so we can then do the best we can to prevent onward spread within a particular setting. And the other thing is when you look at is report your respect everyone's personal space. So if you look at personal spaces, do you have to crowd up with someone you don't know from outside your family? Just respect their personal space. Not only are you looking at what's good for you, but you're also respecting what's good for someone else. The issue of ventilation is really important. So being in a big room with that's well ventilated is important. So if you look at where COVID is transmitting efficiently, particularly in household settings, in businesses, you've got these small enclosed areas, poorly ventilated, windows closed. So think of open windows, good ventilation, and alongside that, think of what else you can do. People need to consider is what activities they can do outdoors rather than indoors, but also things like meetings. Can some of them be virtual? Can some of them be face-to-face? We know face-to-face meetings are important, but consider which ones you'd prefer to do face-to-face and which ones you'd prefer to do virtually. And I think that all forms part of our living responsibly with COVID is looking at our personal choices, our personal responsibility, both as a singularly for ourselves, but also collectively as a community. And I think that's going to be the way that we can progress forward in as safe a way as we can. And so the other thing, finally, to just emphasise again, is reporting symptoms. And I did allude or touch on this earlier, but reporting symptoms, and particularly with Delta, as I've said to you before, those mild symptoms, those bit of a cold, particularly is what we're seeing in vaccinated people. They can actually be highly infectious, but they just feel mildly unwell. Please come forward and be tested, because that will help you, but it will also help your community. So thank you very much. I think it's really positive. We're in a good place. We are seeing community cases. It's what we expected to see. And now we have to move forward together and look at how we can live responsibly with this virus. So thank you.
Thank you very much indeed, Dr. Brink. Questions, please.
You've been very clear about the need to have the first and second vaccination all the way through. How essential do you think the booster vaccination is going to be, and when do you expect it to start rolling out?
Dr. Brink.
So, as always, we follow JCVI advice, and they've looked at this in a lot of detail. So I think, yes, we should be going forward with the booster program in line with JCVI advice, which is what we've all done, or what we've always done. We would hope, we don't have a precise date, but I would think sort of around about October time, we'd be looking at September, October time, depending on vaccine suppliers, when we get the go-ahead to start the program. So we don't have a precise date yet, but we want to be completely ready for when we get the go-ahead to start.
Matthew?
Matthew Leach, Bailiwick Express. Talking about vaccines there, does the introduction of the booster programme mean we now know how long the vaccine protects us against COVID, and how often will we need boosters?
That is a great question. So I think a lot of us would like to know the answer to that. So the answer is no. We're in a new situation. It's an evolving situation. So people have looked at the duration of antibody response. They've looked at the strength of the antibody response. So I think the feeling is that we'll do a booster program, and then it'll be evaluated after that. So we just don't know that answer at this stage.
Ewan Duncan from BBC Guernsey. Interesting to see the stats on those getting COVID, 55% unvaccinated, 45% have been vaccinated. Have you done any studies into those that are vaccinated who've contracted the virus? Roughly when they got their vaccine? Is it people who got it way back when the programme started, or recently, or is it a mix?
So I haven't looked at the precise analysis of numbers, but as a person who phones out a lot of the positive results, it appears to be we're seeing it in different groups, but I couldn't give you an exact percentage at each age group. But we're seeing it in younger people, we're seeing it in older people. So there doesn't seem to be a precise trend at this stage. However, immunity will wane with time, so I wouldn't be surprised if there was a slightly higher number in older people, but I don't have the direct evidence for that.
Next question, please. Yes, ma'am.
Has Public Health done any case modelling based on opening up the island? I mean, are you expecting to reach a certain number of COVID cases based on any calculations or estimations?
Well, I'll ask Dr. Brink to carry on in a moment, but the answer is, I think we've made a point clear both previously and perhaps inferentially today, that there isn't, we're not going to say there's 200 cases, there's 400 cases, therefore we're going to have to take different decisions. It depends on the circumstances going through, really. And the process is not elimination. It is trying to make sure that the health service continue to function and that numbers are manageable. But there isn't a magic X factor, Dr. Brink, is there?
No. There isn't a singular trigger. So as always, we consider a whole island response. It's what we've done. So we look at hospital capacity, we look at community care capacity. We'll be asking the views of our primary care colleagues. So we'll be looking at our testing capacity in the tent. We'll be looking at our resulting capacity in public health, the contact tracing capacity. So it's never a singular decision. So all of those we'd consider with any trigger.
Yes, sir.
Simon Delarue at the Guernsey Press. You've said from the outset that it was always going to be easier to go into a lockdown than to come out of it, and clearly we're seeing some of the complexity now. But as a general question, I wonder whether it might be worth attempting to simplify some of the rules that you have to introduce to bring the community more with you. And I've got a few examples of some of the areas of confusion. So we've had quite a few people getting in touch with us at the Guernsey Press regarding the pass sanitaire. I believe in Jersey they're able to get documentation with a QR code, which enables them relatively free and easy access over there, whereas I think over here we don't at the moment. Earlier this week I was speaking to somebody working at the harbour who was telling me about tourists being turned away who were at the port, believing they'd arrived with all of the correct paperwork and then being turned away. That's anecdotal.
Yeah.
And then I've got one more example that's just been emailed to me by my colleague Juliet, with whom you're very familiar in the last few minutes. There are currently fully vaccinated EU arrivals quarantining in the island, she says. This is with regard to the change of rules coming up on Monday. They had been given advice by the helpline that they could be tested this weekend for release on Monday. However, the early release team has said that they've been given no guidance for the changeover and was not expecting any advice until early next week, leaving these travellers in limbo. So she wants to know what the changeover policy is there. So I know that's a lot to throw.
No,
but
I mean,
different
all
areas
of those are fair
confusion.
points. And the idea of the communication is to improve it at all times, to be as good as it can be. I mean, you've mentioned the French situation. People, non-French residents can now, whether it's from Guernsey or elsewhere, can now contact the French system, Pass Sanitaire, and they will be given information about what they can and cannot do when they go to France. So, but in relation to the EU, the people, the 16th of August is we announced that date some time ago. So if somebody from the EU came across 2 or 3 days ago, they knew that it wasn't in operation until Monday. The intention is that they will be released, if that's the right phrase. I mean, it sounds terrible, but they'll be released from isolation once they've been tested, etc., and they'll be able to go about their business. So they won't have to wait the full 14 days. They may have to wait 3 or 4 days from now. Well, they will have to wait 3 or 4 days from now in relation to that. And as to people not coming with paperwork, again, we encourage people to make as much forward inquiry as they can, because I think it's actually quite simple. But people do forget to bring their paperwork, do forget to do certain things. And we've got it, although it's a relaxed or more relaxed regime, it's still a pretty strict regime, because if you've got rules and you just edge them a bit and edge them a bit and edge them a bit, eventually you've got no rules and no protection. I don't know if you want to add anything, Dr. Breen.
No, I think that covers it all.
Yeah, carry on, sorry.
If I may, I think in this particular case, the last one here, the advice had been received by the case that she's been in touch with, that testing could take place this weekend and then release on Monday. If that changes for somebody coming over from the EU who's only here for a few days, that obviously has quite an impact on
Well, I think we'll make sure that the information is clear so that people are not confused in relation to that. But as I say, it's a bit like let's say I'm not going to go to Spain, but let's say I wanted to go to Spain tomorrow. It's my responsibility to make sure that I understand what the requirements of the Spanish authorities are before I leave these shores. Similarly, and I admire the people that are doing the job and passing out the information, because most people are civil and respectful. Not everybody, sadly, is. And they do it stoically and they do it well. And not always are people as clear in their requests for information as they can be. So, but as I said to you, I think when I began my little ramble a couple of minutes ago, one can always improve and we'll continue to do that. Yes.
Hi, Rebecca Brady from Island FM. We had some listeners call us earlier asking about if you could clarify the situation for them. They have been contact traced. They have a 12-year-old daughter who will be allowed to leave isolation after 7 days, but their sons who are in their early 20s, who are both partially vaccinated or haven't got to the end of their 2 weeks post-second vaccination, will have to spend 13 days in isolation. And they would like to know, well, it seems to this family that the younger people are sort of being penalised despite actually taking up the vaccination. So is that something that could be changed perhaps in the future?
So I think the contact tracing process is always about risk, and I need to rigorously defend our contact tracers because they spend a lot of time defining the risk. And if people have been asked to isolate for 2 weeks, they have looked very carefully. If you look at the numbers of people we self-isolate, it's far lower than many places. And if people have been asked to self-isolate, it will have been for a good reason. Now, we have been looking at younger children and what we can do to help younger children. Because if you're a mum with younger children and trying to self-isolate them on a hot day in a room, it's terribly difficult. So we have been looking at allowing young families to go out and exercise together and then go back in again. This is merely for general physical and mental well-being. If anyone is particularly struggling with their isolation, they can of course apply for a variation, and we do all sorts of things like walk variations and so on. But our population is not fully vaccinated yet, and we have a duty to protect the population when someone has been contact traced. And so I think if there are any concerns, I'd very much encourage them to get in contact with the contact tracers. If they're concerned about their mental and physical well-being, is to get in touch with our variations team. But the contact tracing team really do try and impose the most minimal restrictions possible. And if they put someone into self-isolation for 2 weeks, it'll be because they're concerned about it being a significant contact. And the majority of the cases, as I showed on my slide, are occurring in either partial or unvaccinated individuals. And that's the reality of the situation that we're in now. But if someone is struggling, there are ways in which we can help them.
Thank you. Next question, please. Matthew, then.
Thank you. I was hoping to rephrase my last question. I hope it makes more sense this time, I suppose. I was wondering if you had any modelling to predict what numbers of cases we can expect if we open up, or is it an unknown?
Dr. Brick.
So I think to a degree the number of cases we'll expect will depend on the prevalence of the countries surrounding us, where people are coming from, the number of people travelling in. So we've always modelled for different scenarios, different case numbers, and looked at what we think the hospital can cope with. We always modelled back onto the hospital capacity, and that has formed part of what we presented. However, as we move into an increasingly vaccinated population, we will not only consider what's going on in the hospital, we'll consider what's going on across the island, and it's never going to be a singular trigger.
Thank you. I'm sure you did express your question clearly before. It was me that misunderstood it. Yes, Ewan.
I was going to ask about the booster programme. How many people are you expecting to be given a booster jab in stage 1 and in stage 2? And is it going to be the same booster for everyone, or will there be different variations based on Pfizer, Moderna, AstraZeneca?
So we're waiting for full details on that. So we don't have the granular detail of the booster programme. What we're doing is looking at the high level how we implement it, but we're expecting further details over the next week or 10 days.
Do you have a rough estimate on how many people in the first stage?
Not off the top of my head, sorry.
That's all right.
Yes, sir.
You mentioned about different jurisdictions and their certification, and you're not being entirely satisfied with their certification in certain cases. What's wrong with those types of certification where they are not yet meeting your standards, and how is that going to change?
Well, Dr. Brink will explain that, because she explains it to us every CCA meeting in detail. But we've got to be satisfied that the validity of the certificate is as uncompromised as it can be, as accurate as it can be. Now, we've done it in stages. Obviously, the CTA, the Common Travel Area first, then Europe and EFTA, and now the British Overseas Territories. But I've probably had, and I'm sure my colleagues on the CCA have had, and Dr. Brink must have had it by a multiple of 3 more. I've been to Mustique. Here are my 2 from Mustique. Here are my 2 from America. Here are my 2 from, I don't know, some country outside of Europe. Perhaps Russia we might have a bit of a difficulty with. But in relation to that, why can't I be treated the same way as if I was vaccinated in Jersey or Guernsey? And we're just not happy and content with it yet. But Dr. Brink, I think you can add further, really.
So it's always about the incremental steps as we move forward, and we've always done this incrementally. So we started off with the CTA. We've monitored it carefully. Yes, we're seeing cases in the community, but we're not seeing an exponential increase. So it's broadening the net to then include the whole of Europe, other crown-dependent other areas in Europe. So it's that incremental step, but it's also the ability of the vaccination team, which is not led by public health, but is within the states of Guernsey, to be able to verify that certification. So as always, we have the rights of the individual, but the community is rightly looking at us as we implement all of these changes to ensure that their well-being is also protected. So it's finding this balance. And I think you said going into lockdown was easy because it was a singular decision. We've got a problem. Coming out of lockdown, there are so many competing interests, and everyone, or a lot of people, want things that are slightly different. That it's very difficult to align all of that. So it's that stepwise process, being sure that we can verify the certificates in a comprehensive way.
Yeah. I mean, we're sorry that we've got to take it at that pace, but we'd rather be cautious and careful than expose our community to a danger that may occur.
Sticking on the travel sort of side of things, are there any plans in the future to bring in a sort of digitisation of Guernsey's vaccination certificates? And at the moment, the current certificates that are issued to islanders, are they accepted everywhere in Europe?
Yeah. So yes, there is a plan to bring out digitisation of the certifications. So we're hoping to do that. And as far as I know, it's accepted in Europe. I'm looking at Jason Moriarty now. So the answer is yes.
Thank you, Matthew. Oh, sorry, carry on. No.
Is there a rough timeline for when you might look to do the digitisation?
Jason, do you want to answer that?
End of September estimated, and for people who are travelling outbound into Europe, we do advise everyone to also check the rules of those countries of destination before they travel, but we aren't receiving really any high numbers of inquiries to us saying that they are finding problems with their Guernsey certificate.
Perfect, thank you.
Matthew.
Thank you. I'm sorry to return back to contact tracers, but is the team handling an increased workload at the moment? I ask because we had a member of the public contact us who caught COVID, who believed they should have been contacted.
Dr. Green.
It's impossible for me to comment on individual cases. What I would ask anyone who feels that they caught COVID and they haven't been contact traced, I'd be asking them to please email publichealth@gov.gg. If they think they've got COVID, they've been tested positive and they haven't been contact traced, do they test positive on a lateral flow? Do they test positive through our PCR-based system? So we would need further details before I comment on that. But I'd be very surprised if we had a known positive that we hadn't contact traced. So what will happen is that when we diagnose a positive case, is the person on call usually will, particularly if it's in the evening, will phone the positive route. So that might be, I might make a phone call at sort of 10:30, 11:15 in the evening. At that stage, I will say to someone, you're positive, stay in self-isolation, the contact tracers will be in contact with you in the morning. So it won't necessarily always be on the same day. But for someone to say that they were tested positive and weren't contact traced, I am surprised, and I'd be very interested in knowing those details.
Do you mind if I ask two questions about lateral flow tests? The first part is, many people are asking the question, if they're coming into Guernsey from the UK, they can get a box of 7 NHS-approved tests for free in the UK. Why do they need to pay £25 when they come to Guernsey to get the same tests?
Because we want to make sure that they've received, we could check it here. We want to make sure they're the right type of lateral flow tests, and we want consistency. And frankly, we've explained previously the cost of the tests are about £17 a residence administration fee. We've made that clear well before. It's a small cost to be able to travel here. And again, the point that Dr. Brink has made in one of her previous answers, and I emphasise again, we've got to look to protect our own community. So if somebody feels that they genuinely can't afford to pay the £25, then perhaps they should save up, I don't mean to be facetious, and come again when they've got the £25. We've got to ensure that this community is kept safe. We think it's a very understated and moderate request that we make of people, and the cost is minimal.
And my second part of that question is, it's been projected by Guernsey Football Club and Guernsey Raiders that to get all their fixtures played this season, the cost could be somewhere between £10,000 to £25,000 in extra cost for those clubs based on the fact that the £25 lateral flow test and what that will mean for their players. Obviously, inter-island competitions this year between Guernsey and Jersey have been cancelled, but the cost is prohibitive again. Is there a way that we can find for our sports clubs to be able to compete this season, considering what they've had in the last couple of years, without this financial challenge? And have you had any discussions with the clubs or the Sports Commission?
We've certainly had discussions with the Sports Commission. They came and see me and Deputy Brouard just over a week ago, I think, certainly relatively recently. We discussed that kind of question that you've asked. We're keeping the decision about lateral flow tests under review. We've made that point. This is a situation that we're reviewing constantly, but I think we'll particularly review once people have been vaccinated, once we've got to that next stage. But what we can't do, and of course we all value sport, both of those sporting institutions that you mentioned are a credit to Guernsey. They take the sport beyond Guernsey, and we welcome the visitors that come in. But we've got to be consistent. We've got to be consistent. We can't have special rules for special people, but we're looking at it, we're having regard to it. And I would hope, but Dr. Brink is the expert, I would hope that we wouldn't be able to, that we may be able to attenuate the matter in the foreseeable future. Do you want to add anything?
Yeah, no, absolutely. So once we finish the vaccination programme, we'll then be evaluating whether we can then phase out the post-arrival lateral flow testing, but it will depend on what the prevailing conditions are at that time. So post-arrival lateral flow testing was never designed to last forever. It was designed to help us get to the end of the vaccination programme without overwhelming the community with the number of cases. So it was designed as a mitigation and was never designed to be an indefinite response.
The follow-up question then is, when do you expect the vaccination programme to be finished, based on now we're doing 16, 17-year-olds and those who still haven't had it?
So we're modelling the end of the vaccination programme as the end of the primary vaccination programme, which is the completion of the 18s and overs. We know by the end of this month we'll have about 200 people that we still have to catch up with for various reasons. So by the time we reach the middle of September, we should be in a really good position with the majority of people over 18, vast majority, double vaxxed plus 2 weeks.
So we could be looking by October to maybe start phasing out lateral flow tests.
Correct, but again, depending on the prevailing situation. So during September, the schools will go back, we'll monitor the impact of the schools going back, and then the next step will be looking at the post-arrival testing. So as ever, it's trying to align and balance all the potential risks.
Any other questions? Matthew, and then you, sir. Matthew.
Where will people receive their booster vaccinations? Will it be held in the vaccination centre? Will it be the same as it is right now?
Well, again, we're looking at that. As I said earlier, the intention is that this centre will be continued to be used until the end of the year. The discussions also with primary care, but the very least, or probably the very most, it'll be in this building. You, sir, and then you, sorry.
I understand, Guernsey Press again, sorry. I understand that there's been some communication from the government of Sark regarding positive COVID cases in people who had recently visited the island. Can you give us some more information about what's happened there and what cooperation you're able to provide to the island about surge testing, maybe?
Can you?
Yeah, I mean, I think one of the positive aspects of this pandemic is that all of the islands have worked really closely together. So Guernsey, Alderney, Sark and Herm have literally worked as a single entity. So from the start of the pandemic, we've worked very closely with the Sark authorities on a number of matters. And we identified a cluster of cases who had been in Sark, but had subsequently returned to Guernsey. And what we've done is some surge testing around 3 hospitality sites there. And I'm not going to name the hospitality sites. We've done some surge testing around there. This forms part of what we planned for. And I have to say, Sark just swung into it and did what we planned for, which was roll out the surge testing. So we've been working with the Sark nurse and the Sark GP with regard to that. And we'll wait. Those test results. Tests came across on the 11:15 boat, so we'll be looking at those results later this evening and into tomorrow.
Just before I ask my question, following up from that, how many people roughly are being surge tested in Sark? Do you have?
I don't have the final numbers on that, but it'll be, I would estimate, 30, 40, around about that sort of number. But that's that's a guess and not an accurate number, so please don't quote me on that.
Great. I was going to ask you, Dr. Brink, about the drop-in clinics for people who are pregnant on Sunday. Obviously, scientists have recently confirmed that it's safe for pregnant women to have the vaccine. So what's the message that you would like to put out to pregnant islanders?
So we would encourage them to get the vaccination in line with guidelines. What we've tried to do is a more bespoke program for our pregnant women. The reason being is they will understandably perhaps have more questions, and it's led by a very experienced midwife, Alex Hawkins-Drew, and she's been leading that program together with a team of midwives who are both experienced vaccinators but also midwives. And the feedback that we've had from those clinics has been really good, and pregnant women have appreciated having a more bespoke service than having the more general service, great as it is in the vaccination centre, but that they could focus on specific pregnancy associated questions. And I think that's absolutely key, that we don't design one-size-fits-all programs, that we actually look at how we can address the needs of special groups. So, for example, with the learning disability, the team went out and vaccinated those people in an environment that they were familiar with. So it's trying to get the program so that we balance getting large numbers through, which we absolutely have to because we've delivered the program at pace and really effectively, but also not losing sight of the more bespoke needs of some groups.
Could I also just briefly ask, is it different because symptoms and sort of side effects of the vaccine could affect pregnant women differently?
No, it's more about people are likely to have more questions, and specifically perhaps related to the pregnancy associated concerns that they have. So it's to ensure that we have the right team there to answer the questions effectively. So it's not for a specific clinical concern, it's more to provide a better service, if that makes sense.
Channel TV.
Thank you. So France has introduced the Pass Sanitaire. It does look like a bit of a faff. Is there any plans to include QR codes in the certificates, the passports, or the digital ones to make life a bit easier?
Well, I think I covered that in a previous answer. People can contact France now. The technology is such that we're doing our best. I think what we've got to appreciate as well, I was looking at the statistics, a couple of things. I'm just amazed, as you know, I'm the chair of the authority, but I don't do the work. The work's done by everybody else. I just get up and speak and make pronouncements. The position in relation to it is that everybody is under such real pressure. People have been working flat out for 18 months, solving all kinds of problems, answering all kinds of queries, dealing with changing situations. And I was dealing with something struck me when I was watching the telly the other night, watching this 100 cricket thing. And there was a ex-New Zealand cricketer who was thinking about going home once he'd finished his stint as a cricket commentator. He can't return to New Zealand till February because all the isolation hotels are full. And anybody going into New Zealand has to go into an isolation hotel. So the fact that it is still a little bit more difficult than we hoped it would be for people travelling to France, we're very sorry, but in the scheme of things, I'm sorry, we're doing the best we can. Matthew, and then...
Last question from me today. People like to follow the state's social media for important updates and serious developments. However, we've spoken to a number of people who don't want to be reminded of daily positive cases. If they want that information, they can get it from your website, for example. What is the merit of providing daily updates of 1 or 2 cases if we're aiming to live with the virus?
Well, I'll ask Dr. Brink to deal with that in a moment, because we are going to try and wean people off that because of the point that you've just made inferentially in your question. But if we were to do it tomorrow, people would be saying, well, you must have another 50 cases, you must have another 30 cases, why aren't you telling us that? So it is a difficult balance, but Dr. Brink.
Yeah, so I think it's a really valid point, and it's one that we've had numerous conversations about. If we don't give the information, will people get upset? If we do give the information, will people say they're constantly reminded? So what we were planning to do is wait until the end of the vaccination program and produce literally a dashboard that we have on our website, and that would include, for example, number of cases, 14-day rate, hospitalizations, deaths, some key information like that. So those who want to get it can go there. But the plan was to wait until we'd completed our vaccination program, because once we've done that, we've actually done all we can from an intervention point of view to protect the population. But I think it's a really valid point, and I actually don't know the right answer, and we've kind of jumped to either side of the fence, and until we said, well, let's finish our vaccination program, and then at that stage go just to putting the information up daily on our website in a dashboard format. So I know that doesn't answer your question completely, but I don't know what the right answer is.
I think it's a good answer.
I was just going to ask, is there a set time period that must elapse after the second vaccination before you can be eligible for a booster jab? And is everyone that's had a second jab going to eventually get a booster?
So, to answer your first question, you would want months to have elapsed. There's no point in giving someone a booster. So actually, if you look at the primary program, the first dose is actually your priming dose, and the second dose of vaccine is actually your first boost, but it's part of the primary immunisation program. So you wouldn't want to give a booster for some months. I think that's reasonable. So at least sort of like 6 months or so would be a sensible number with regard to lapsing. With regard to the second question, I think it's too early to say, because they're looking at the antibody responses now in the younger people that were more recently immunised. So they'll start looking at those vaccine responses and try and calculate when an optimal time for the administration of a third dose, if it's required. And we then don't know, after you've had your third dose, is at what frequency you'd require any further boosting, if any.
So it's not guaranteed we'll need a fourth booster at some point, or it could be a couple of years.
No, and it's also not guaranteed what the boost would be. So if you've got a variant of concern for which the vaccine had reduced the vaccine efficacy, you would then look at a tweaked booster, so not exactly the same virus. So all of those things are really up in the air at the moment. And I think that's been one of the challenges, is it's very difficult to say, well, here's a program, this is what we're going to deliver. I mean, we know how we deliver an MMR program, measles, mumps, and rubella. We know how we deliver our HPV program. And I can see why people get a little frustrated that we can't say exactly what's going to happen, but that's because we genuinely don't know.
And again, a question you're probably going to say, I'm not sure yet, but is the third dose, the booster jab, going to be in conjunction with the flu jab that we'd kind of talked about, but you weren't sure?
Yeah, so Comcov haven't reported on that yet, and we simply don't know at this stage, and we're unlikely to know before September time, probably middle of September. So again, it means that we've got to do lots of different scenarios with regard to preparation.
As we get to a higher percentage of people who are either fully vaccinated or on the way to getting fully vaccinated, are you satisfied that the remaining percentage, which by my clumsy maths is probably about 3,000 people, are not getting vaccinated because they are against the idea, they're actually antagonistic to the idea of being vaccinated? Or do you think that there's going to be a point where you need to proactively go out and find people, provide information for people who are hesitant for other reasons? And I ask the question because I spoke to a homeless man earlier this week who has not been vaccinated, and to his friend who said that she'd never received a letter, and they were both quite interested when I started telling them about how you could go about getting vaccinated. So there might be quite a number of people, not just homeless, but other people around the island who simply the message hasn't quite come through despite all of these briefings.
That's a good point. I mean, you're right, the more communication the better, and trying to persuade people and trying to inform people, because some people need to be persuaded, others, you rightly say, still might need to be informed. So I think it's a continuing process, Dr. Briggs.
Yeah, I think it is, and I think once we've delivered the bulk of the immunisation programme, actually going to find hard to reach groups. So, for example, in my other role is I provide clinical care for people living with HIV on the island. So we've run a bespoke program within the Orchard Centre for that group of individuals. So it's now going round and finding out which groups haven't been vaccinated just because they haven't, for whatever reason, accessed the programs, and which groups don't want the vaccine. So it's separating off those two and making sure that as much as possible, we're never going to be 100% successful, but as much as possible is we manage to try and provide a service to those that are perhaps harder to reach.
And on another a follow-up, as it's about vaccination as well, this is a slightly different subject. I know that you're following UK relevant advice regarding who we inoculate. But in your professional opinion, eventually, down to what age do you think we're going to end up vaccinating people? Are we going to be vaccinating infants?
The data, I think infants is probably going a bit far. I think the data on 12 to 16-year-olds, I think people are going to be looking at that. They're going to be looking at what's happened in America, what's happened in other countries like Israel, and that evaluation is ongoing. So I think it's too early to say what will happen with that group.
Following up really from your question, Dr. Deputy got up asked two questions, one of which we've already answered. His other question really, I think, flows from yours. He said, is there any possibility of the development of free vaccination protection and passports for teenagers 12 to 16 with Pfizer products to facilitate family travel possibilities? And the answer to that is at the moment no, really in relation to that, but that may change over a period of time.
And I think the other point too, we do vaccinate younger children if there is a specific clinical risk. So there are groups of 16 and 17-year-olds prior to us starting the programme, just for example, that have already had the vaccine because of a clinical risk situation.
Anybody else with any other questions? Otherwise, I thank everybody for their questions. I thank everybody for listening and watching. Keep safe, keep happy and keep optimistic because there's much to look forward to. Thank you very much indeed.